All right, I'm going to show you how to clip a patient for a spay surgery and a neuter surgery. First, I'm going to do the spay. So we have landmarks from the xiphoid process to mid-pubis, and you're going to go about a clipper blade or a clipper blade and a half outside of where the incision site is. So you're just going to clip up holding the clippers like a pencil, and we are using a number 40 blade to get a close cut. And just watch out for the nipples. You're going to have to clip around them. And then once you get up more towards where the xiphoid process is, if the dog does have longer hair, you just want to brush it down, and you just want to make a little cut there and just go about 1 millimeters down just to get any long hair that you see. And you may have to put the clipper blade in different directions because the hair will grow in different directions. And that is how you do a dog spay. Next, for the dog neuter, we do have different landmarks. So our landmarks are going to be from the cranial border of the testes to the mid-pubis. So what you're going to do is you're going to push the testes forward, and then you're going to clip the cranial border of that because that is where the doctor will make her incision. And you're just going to clip along there and clip in different directions around the testicles just because the hair will grow differently. And you're going to do about a clipper's blade outside of the incision site for your other landmark. So just clip around there, and again, we're using a number 40 blade to get a close cut on our patient. You're just going to want to make sure you don't press too hard because you do not want to have our clipper burn on our patient. So after that, after our patient has been prepped, we will just use a vacuum just to get up any loose hair before we start our scrub. So we are going to use a chlorhexidine solution, and the reason that we use chlorhexidine is because it has a shorter contact time and a longer residual time, whereas iodine is on the opposite. And iodine will stain the patient, and some clients don't like to see the stain, and it also may react to some patients' skin. So what we're going to do is we are going to just fold it in half, and then in half again. Make sure you're not touching any of the edges where it's going to touch our patient, and then you're just going to do a dirty scrub for your first one just to start that contact time. All right, so our contact time is done, or is beginning, and then it takes about 30 seconds for that. And then now we can start our scrub. So I do have about 4 to 5 gauze pads in there, just in case our patient is a little bit dirtier. So what you're going to do is then you're just going to rub on the incision, and I'm doing a dog spay scrubs. Rub on the incision, and then you're just going to do a target pattern around the incision site, just to get all the dirt to the outside of our patient. So you're going to do about 3 chlorhexidine scrubs and about 3 alcohol scrubs. So you can either do all your chlorhexidine scrubs and then all your alcohol scrubs, or you can do your chlorhexidine and then your alcohol, and you're just going to do 3 of those. So with the alcohol, you're just going to do the same thing. Just scrub the incision site and just go around your patient. All right. And the reason, there are different times to use alcohol versus sterile water. So you never want to use alcohol when you are working with something that has an electrical current. So if we're doing, say, a cat declaw and they use a laser, you're going to want to use sterile water, just because the electrical current will react with the alcohol and your kitten may start on fire. So you just want to be careful watching with that. All right, so then you'll just do your second alcohol scrub, and your second chlorhexidine scrub, and now your alcohol scrub, and just make sure patient is not dirty anymore. And that is how you surgically prep a patient using a target pattern.